Assalamu alaikum. Today I'm going to explain epidural hemorrhage. There are different types of hemorrhages. We have the epidural, the subdural, subarachnoid, and the intracerebral hemorrhage. All the four types have different locations, have different spaces, different causes, and different consequences. So, we have here the skull bone. The dura mater under it has two layers, the periosteal layer and the meningeal layer. Here we have the periosteal layer of dura mater, and then in red we have the meningeal layer. Naturally, we have between the periosteal layer and the meningeal layer a venous dural and sinus, where blood is flowing naturally, and the space is lined by endothelial cells. It is physiologically. But we have some places where the periosteal layer and the meningeal layer are very close to each other. They can be separated, but they are called potential spaces. There is no actual space. And you see here, like a meningeal artery and a meningeal vein. So, what happens actually? We have here the skull from above. You have here the foramen magnum. And here at the medial cranial fossa, we have the foramen spinosum. Which artery goes out? It is the anterior branch of middle meningeal artery and vein. So, it runs between, to be very accurate, it runs between the two layers of dura mater. So, what happens? For example, if someone hits or get an injury on the temporal bone area and the parietal bone area, and the bone fractures, the vessels in these areas ruptures. And if they rupture, bleeding happens. So that bleeding accumulates between the skull and the dura mater. So here is an example. We just zoom in. So I just taken here a part of it and zoom here in. We have here the vessels, meningeal artery and vein. We have here the blood accumulation, and the blood accumulation goes out of the meningeal layer, which will be called epidural space, or within the epidural space, which is called epidural hemorrhage, also called extradural hemorrhage. So, of course, for you, if you're watching, for the doctors here who want to know more about the clinical features, I will explain it right now. The causes of this blood accumulation or epidural hemorrhage is a trauma to the skull. The area can be the temporal bone, because the temporal bone area is I can say very weak for a fracture. So clinically, we have a lucid interval. What is a lucid interval? The lucid interval is the interval, or is the time between the injury, the time of the injury, and the time of losing your consciousness, okay, or so-called coma. What happens? There are like two types. Sometimes a patient can get an injury, gets unconscious, and it gets a rapid healing. There is no hemorrhage. Sometimes there is an injury, gets unconscious, we have an epidural hemorrhage, gets conscious again, and then after days or weeks, gradually falls into a lower level of conscious level, because there is the epidural hemorrhage. So we have like an up and down, up and down. So this is a sign of course, of epidural hemorrhage. And if you think, or if you have assumptions of epidural hemorrhage, you do a CT scan. In the CT scan, you see dense image, and that area of epidural hemorrhage is more dense than the brain substance. So it is a typical sign of epidural hemorrhage. I hope you understood this quick summary. If you have any questions, please write it down in the comments below or write me on Instagram. I will be grateful. Thank you.